So what are the dangers of prostate cancer testing? And what are the dangers of prostate cancer awareness programs? These subjects are very important for you to get into because they are full of health dangers. Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon and former researcher, and this channel is all about sorting out medical fact from medical fiction. By the way, HEALTHdrum provides material for educational and informational purposes only and is not a substitute for professional medical advice. The links to the disclaimer and the material in this video are in the description below. And if you like to get fact-based healthcare information, please hit the subscribe button for me. Okay, so let's get into it. So prostate cancer testing is heavily marketed by the prostate cancer awareness programs and Blue September. But are these tests safe or are they dangerous? Let's check the messaging. So these are some of the typical messages used by the prostate cancer industry for prostate cancer awareness and getting tested. Claims such as, if you have urinary or sexual issues, get checked, and other claims such as, catch it before it spreads, a quick test can save your life, know your numbers, know your risks, and early treatment preserves quality of life. All of these messages sound very reasonable and convincing, but these messages are all without any scientific evidence for benefit. They are simply hollow claims. In fact, prostate cancer awareness programs and Blue September are all about fear-packed slogans trying to scare men into thinking that they are at great risk from dying from prostate cancer. So you've been persuaded by this false messaging to get screened for prostate cancer. So what are these tests about? So there are two basic tests that are performed to screen for prostate cancer. Again, before we go on, I want to reiterate that although commonly marketed as being early warning signs of prostate cancer by the prostate cancer machine, urinary and sexual symptoms are not early warning signs of prostate cancer. They are simply signs of aging. So the first test that is commonly undertaken is the prostate exam to try and determine if there are any hard areas or irregularities that may be consistent with prostate cancer. This test is highly unreliable and prone to observer error. The next test is the prostate-specific antigen or PSA, and this blood test is also highly unreliable. I have other videos about these tests explaining the many dangers. In addition, urologists' own studies have already concluded that PSA testing fails to save significant numbers of lives. Instead, any abnormalities detected with these highly unreliable tests invariably leads you to more unreliable and risky tests. So because the prostate exam and the PSA test are highly unreliable, it's not uncommon for the doctor to tell you that there's an abnormality with one or both tests and that they suggest doing an MRI and prostate biopsy. Well, what are these tests about, and are there any dangers here? So now you've been told by your doctor that there's something wrong with the prostate exam or the PSA is off, and next they're going to tell you they're more comfortable with getting a non-contrast MRI of the prostate, and they will likely also tell you that you need to have a biopsy because the imaging studies are not foolproof. So it's important for you to realize that not all imaging software and techniques and radiologists are equal, because some radiologists are much better than others. So MRI images are associated with false positives and false negatives. Prostate cancer growths need to be at least 5 millimeters or so in order to be detected. Prostate needle biopsies are associated with a gross sampling error because usually only about 12 needle cores are taken, and when the volume of those 12 cores is measured against the volume of the prostate, only about 0.1% of the prostate is being sampled. Therefore, the physician is managing your condition on the basis of a 0.1% sampling of the prostate. As well, the needle biopsy is risky and associated with several significant potential complications, such as septic shock, bleeding, urinary retention, urinary tract infections, prostate infections, erectile dysfunction, and so on. So you've been talked into having the prostate needle biopsy. Now they tell you that you have an area of cancer. And now they're starting to talk about treatment options before you've even had time to digest the information. What are these options about? So these are the treatment options that they will start talking about. Options such as surgery, open or robotic assisted, radiation with or without androgen deprivation therapy, which is testosterone suppression therapy, then brachytherapy, which is insertion of radioactive seeds, proton beam, and focal therapy options using high-intensity focused ultrasound or HIFU, cryoablation or freezing, laser, or photodynamic therapy. Lastly, they may discuss another treatment option, which is active surveillance or monitoring your cancer and only treating it if there are signs of progression. But what they won't tell you is that these various treatment options for prostate cancer went from a belief that it should work to accepted practice to standard practice and miraculously morphed into being standard of care without any scientific testing for safety or benefits. So you already know the dangers about prostate cancer testing. What about the dangers associated with prostate cancer treatments? So prostate cancer treatments are associated with a bucket load of potential complications. Surgery in particular is associated with many complications, and one of the biggest problems with both open and robotic surgery is residual cancer or a positive surgical margin. This is cancer that's been left behind and occurs in at least 11 to 48% of patients. The rest of the treatments are associated with a rising PSA or biochemical recurrence, and this occurs in at least 20 to 50% of patients within 10 years of treatment. And this means that there are cancer cells somewhere in the body and that you have not been cured. There are other general complications common to surgery, such as rectal tears, hematomas, urinoma, DVT, and so on. And all treatments are associated with potential urinary and bladder complications, including urethral scarring, urinary incontinence, bladder stones, infections, and so on. As well, all treatments are associated with possible sexual and penile complications, and these include loss of erections, decreased penile sensation, lack of ejaculation, shortened penis, infertility, and so on. It's little wonder that some 20% of patients have treatment regret. So how are these many treatment complications corrected? So now you've already been treated for the prostate cancer, and now you need to have additional treatments to treat the complications. And although surgeons are quick to promote surgery over radiation, they are the first to suggest radiation for residual cancer or a positive margin. A rising PSA or biochemical recurrence is common after any treatment, and a rising PSA means that there are some cancer cells somewhere and you are not cured. This is usually treated with observation until the PSA reaches a certain level, when androgen deprivation therapy or testosterone suppression is started. Testosterone suppression is also associated with a long list of complications like hot flashes, mood swings, breast enlargement, and many other issues. Your leakage problems are commonly treated with pads, penile clamps, catheters, pelvic floor exercises, biofeedback, injections, slings, or implants. On the other hand, erection problems are commonly treated with medications, suction and vibration devices, penile injections, or penile implants. These many health dangers and complications are discussed further in the various links in the description below, as well as in my other videos. So you've had a very miserable and frustrating prostate cancer journey, but do these treatments save significant numbers of lives? So are prostate cancer treatments curative, or do they fail to cure? Well, in fact, shockingly, urologists' own studies have concluded that at about 20 years, those that had no treatment had similar survival rates to those that had radical treatments. But those that had no treatment had none of the complications commonly associated with the treatments. The fact that prostate cancer treatments show no scientific evidence for cure explodes the myth of early detection and treatment. And how is it possible that so much information about prostate cancer testing and treatment is simply misleading? So how come all of this misleading information about prostate cancer testing and treatment becomes standard of care? So why is all this prostate cancer information misleading? Well, prostate cancer awareness programs have trapped man in a cycle of fear, failed testing, and ineffective treatments because most, if not all, prostate cancer treatments went from being an idea or belief that it should work to accepted practice, to standard practice, and then standard of care without any scientific testing for safety or benefits. As well, most studies are not founded on sound scientific principles because virtually all studies are fatally compromised by lumping together patients with the harmless Gleason 6 pseudocancer, various Gleason grades and scores, variable tumor volumes, and others arbitrarily treated with testosterone suppression to produce results that are scientifically worthless. Also, many of the studies have self-serving definitions of success, such as considering patients dry even if they use at least one pad a day. There's also a big problem of financial incentives because treatments and misinformation are profitable, whereas monitoring is not. And there's been an abject failure on the part of the American regulatory apparatus to protect unwitting and vulnerable patients by ensuring that tests and treatments for prostate cancer are supported by irrefutable and reproducible data for safety and benefits. Instead, the untold story in the prostate cancer arena is that bad science and big money have misled and harmed millions of men. So after all of these scare tactics and misinformation, how is it that the informed consent never mentioned any of these facts? So these are the facts well known to physicians but withheld from the informed consent prior to any treatment for prostate cancer. That PSA testing fails to save significant numbers of lives, that some 11 to 48% of surgical patients, whether open or robotic, are left with residual cancer, that about 20 to 50% of patients will have a rising PSA within 10 years of treatment, a result that means there are prostate cancer cells somewhere in the body producing PSA and that you have not been cured. As well, you will not see in the informed consent that at about 20 years, radical treatments have not saved significant numbers of lives when compared to those that had no treatment. As well, the untreated patients had none of the complications normally associated with treatments. So clearly the claims about prostate cancer treatments being effective are absolutely false, as urologists are fully aware of the facts in this screenshot as the data comes from their own studies. Furthermore, they are aware as they routinely employ strategies to manage patient expectations before treatment, knowing that the treatments are associated with all these bad complications. Obviously, if you had known in the informed consent that the tests and treatments were not life-saving, and instead left you with many complications that needed additional treatments, you probably would never have elected to be treated for your prostate cancer and instead elected doing nothing or monitoring. Unsurprisingly, prostate cancer awareness and Blue September programs are a gigantic hoax that only lead countless men to health dangers. Physicians are quite aware that most prostate cancers are outlived. So now you realize that many important facts are left out of the so-called informed consent. So you've been left with complications and what sort of liability actions are available for you. So this screenshot lists some of the remedies available to those that have been hurt and were misled by the so-called informed consent. So the real question is, how long will society tolerate medical fraud disguised as prevention, and when will those responsible for the false prostate cancer narrative be held liable? Informed consents are supposed to inform you completely, but typically informed consents for prostate cancer treatments don't let you know that PSA testing fails to save significant numbers of lives, that surgery, whether open or robotic, is associated with a positive margin or residual cancer in 11 to 48% of patients, and that some 20 to 50% of patients will have a rising PSA within 10 years of treatment, meaning that they're not cured, and that by 20 years, those that had radical treatments and those that had no treatment have similar survival rates. Sadly, the fundamental reason why the prostate cancer narrative is absolutely false is because physicians have failed to challenge the recommendations for tests and treatments with the most basic of medical challenges. Where is the irrefutable and reproducible data supporting this recommendation? And if doctors had asked this very simple and important question, these tests and treatments for prostate cancer would not be labeled standard of care. In fact, PSA testing and prostate cancer treatments are a gigantic healthcare trap that makes money from health robbery. All of these details have been withheld from the informed consent. So, if you've been harmed, you likely have legal remedies that you can explore. And if you've been harmed by prostate cancer testing and treatment, please let me know. So let's recap. In this video, what are the dangers of prostate cancer testing? You learned that prostate cancer testing is associated with many dangers. Prostate cancer treatments are associated with even more dangers, and that prostate cancer treatments fail to save significant numbers of lives. To learn more about routine medical conditions, self-care, and digital health, check out these other videos, and if you like them, please share them with your friends.